Welcome back to Empower Yourself. Today we are going to learn an important topic. Deviation. So let us see about deviation. Let us see the definition. So the definition goes like this. Departure from an approved procedure or an established standard. So it is clearly said that it is moving away from already approved procedure. So this is the definition of the deviation. Let us see in detail about the types of the deviations and how that would be categorized and the examples of each and every type of deviation. So here comes the types of deviations. There are three types of deviations. One is critical deviation, major deviations, minor deviations. So let us see in detail each one. Critical deviation. Let us go with the definition. Any observed deviation which has the potential to impact the patient's safety with highly probability leading to life-threatening situation or any regulatory violation leading to regulatory enforcement. So here it is being said that which has the potential to impact the patient's safety. So whatever the situation that are having the potential to impact the patient's safety, such a type of situation or condition is a critical deviation. So let us see the examples. Here comes the examples are the product mix-ups or cross-contamination. Product mix-ups could be a mix-up of an X product and a Y product or a Y product in an X product. Breaches of the data integrity, data falsification or manipulation. So the data integrity breaches means data falsification. That means we are not giving the accurate information or manipulating the exact result with the result that is meeting the specification or the limits that we are being established. So this could also be a critical deviation, which is considered to be the breaches to data integrity. Next is failure to meet the commitments made to the regulatory agencies, leading to the enforcement actions such as suspension of license or forced recalls. So not meeting the commitments made to the regulatory agencies. So nowadays we are looking forward into one of the major topics like nitrosamines. This is the major regulatory agency's requirement and it is a commitment of each and every industry to be followed. So if those people could not meet or could not provide the data for the nitrosamines, then and if they give the false reasons or the false data, then it would lead to the suspension of the licenses or the forced recalls. So these are the types of, or the examples of the critical deviations where it is impacting the patient safety. Next, it is the major deviation. So a deviation which may have direct or indirect impact on the quality, yield, system, and physical characteristics of a product, system, utilities, equipment. The impact of such deviation may not be critical to the patient's safety. So here it is say that it may have impact, either it could be direct or indirect impact on the quality, yield and system, but not upon the patient safety. So if there are such a situations, which doesn't have any impact upon the patient safety, but have an impact upon the quality, yield, or the system, then it could be considered as a major deviation. So here comes some of the examples of the major deviations. Deviation in critical process or operating parameter, critical components or the equipments or the instruments, product quality attributes, etc. So it could be a deviation in the temperature maintenance, like critical process parameter, which may have impact upon the quality or yield that we get, or we may not be able to meet the quality and yield of the product. Such a situation can be considered as a major deviation. Usage of unapproved raw material in a batch. So prior to the approval of the raw material from the quality control, if you are using it in the process, then it could be an unapproved material, which could be considered as a major deviation. So production started without line clearance. So when we are moving from one product to another product in the same facility or in the same equipment, then it could be a major deviation, because line clearance is a very important part during the manufacture of the product. Next, involvement of untrained personnel in CGMP activities. So whenever an untrained person is involved in the manufacturing of the product, they may not have the sufficient knowledge to perform the activities. So he may use the other materials, or he may charge the other materials, he may maintain in such a way with the knowledge that he has. So such a type of conditions or such a type of circumstances can lead to the deviation, and which will have impact upon the quality, yield, and system of the product. So it is important that the persons should be trained to avoid such a kind of deviations. So involvement of untrained personnel in CGMP activities or GMP activities could lead to major deviations. Quality failure of an API or its intermediate stage batches. So whenever the failure is seen in the API or its intermediate batches, can also be considered as a major deviation, because it could be because of the direct or indirect effect on the quality. So this is the major deviations, and these are the examples of the deviation. And let us see the another deviation. That is minor deviations. So a deviation which may not impact on the product quality, yield, system, and physical characteristics of a product, utilities, and equipment is considered as minor deviation. So any deviation which doesn't have any impact on the quality, yield, system, as well as on the patient safety, so that type of deviation is a minor deviation. So here are some of the examples for the minor deviations. So those are deviations observed in non-critical process or operating parameters. So it could be a deviation in the non-critical parameter in the BPR. Minor discrepancies in the document. So any overwritings or any strike-offs in the documents could be the minor deviations. For example, like the washings of the utensils that is being used in the process. Analytical instrument breakdowns. So instrumentational breakdowns could be also before performing the activity, before including the sample into the activity or during the analysis. When there is no involvement of the sample, then it could be considered as a minor deviation. Deviation from approved schedule where no impact is foreseen. So deviation where there is no impact is seen when we are missing the schedule, when we are missing to follow the approved schedule. That could be the preventive maintenance schedule, or it could be the calibration schedules, or whatever the schedules where the impact is not seen, then it could be considered as minor deviation. Failure to meet the SST criteria in QC laboratories. So, when we are performing a system suitability criteria during the analysis, then if there is any failure to meet the SST criteria, that could also be considered as a minor deviation. Deviation in FIFO principles. So, as we know that FIFO principle is also important, first in and first out. But if there is a deviation in FIFO principle using of the first in material or first out material, it could be, if we are deviating from that, then it could be a minor deviation. If we are not following the FIFO first in first out, but rather we are taking, there could be some product which could be expired first, then if we are taking such a product in the first out principle, then there could be, then that deviation could be called as the minor deviations. So these are the three types of the deviations, that is critical, major and minor deviations, which are categorized for deviations. So these deviations are being followed in the systems that when we are deviating from the approved procedures. So these all things to be followed in a proper way, and it should have to be documented in such a way there will be a proper justification and there will not be any impact based upon the type of the deviation that has been seen. So let's see some of the references where we could talk and learn, where we could see about deviation is ICH Q7 guideline, Uralex Volume 4, Schedule M, WHO GMP 21 CFR Part 210 and 211, and CDER. These are the references that we can go through to know more about the deviations. So I hope this topic deviation has helped to know about the types of deviations and the examples that are for each and every category. Thank you for watching and learning. Thank you so much. Please do subscribe, share and like for more videos. Thank you.